Congratulations on your purchase of a RipMedic home scenar device, undoubtedly one of the most powerful pain relief tools in the world. This DVD will give you enough instruction to become proficient in the basic use of this device to rapidly deal with pain. The techniques you will use allow the body to mobilise its own internal pharmacy of bioactive compounds, giving very fast pain relief, a greater sense of well-being and very much faster recovery times. Please see the whole of this DVD before you use this remarkable technology. Thank you.
My name is Catherine Remington. I'm trained as a medical doctor, and after 15 years in general practice I retrained as a scenar practitioner. I found the scenar remarkable in using it to treat a variety of pain-related conditions. These include back pain, either acute or chronic pain, including sciatica, neck pain, also whiplash, joint pains. It's invaluable for treating painful elbows, knees, RSI, and also it's extremely useful for sports injuries.
To see it from this perspective, the scanner will give an impulse, an electrical impulse. And the kind of impulse it gives mimics the nervous system. It's the way the nervous system works. And the first impulse the scanner will give is one of a pathological nature, meaning that it says something is wrong here. The body then responds to that because it sees it as if it's the body itself is giving it information, the brain is getting information from another part of the body. It will then respond, and the scanner can then analyze the response. It looks at the waveform, it does mathematical calculations on that. All that has been worked out with years of research. It will then respond back to that and will coach the body towards adapting a different attitude towards the problem that is there, because it was obviously not dealing with it in the right way. In the way it's waking the body up to its normal healing abilities. I've been working with this kind of device now for about 4 years, and even though at times I use it for other problems than there's pain, for pain relief it is a fantastic device, a beautiful device. It is so immediate, it is so effective, and I find that very often it is quicker than the use of acupuncture to relieve pain. And what makes the scanner such a brilliant device is that it's the ease of use, because it has the same scope as acupuncture, but the manner in which you can use it, you don't have to do all the study of 3 years. There are basic ways of working that you can use, particularly if you only want to use it for pain relief. And the pain relief will also actually help to settle the problem. It's not just ease the pain, it will try to cure the problem that is causing the pain.
Scenar is undoubtedly one of the most powerful pain relief devices known to man. Originally developed by a team of Russian scientists and doctors for use by cosmonauts in space, this incredible technology is now available for everyone and is simple and safe to use. Once the scenar has been switched on and the power level set, it is ready for use. First, identify the point of greatest pain on the area you wish to treat. Next, brush the scenar over the point of pain in 4 directions in the shape of a cross. Normally, the scenar moves smoothly over healthy areas, but over an injured area, the scenar will meet resistance from the skin and feel sticky. The direction of greatest stickiness tells you which way to brush the scenar in order to relieve the pain. Once this has been determined, brush the point repeatedly in that direction. It doesn't matter which area of the body you are treating, the technique is basically the same. Continue brushing the small area rapidly, and in most cases it will take less than a minute to notice a change in the skin's resistance. In just this short period of time, the pain will have reduced significantly or have completely disappeared. For the first time ever, space-age medical technology is available with an instructional DVD, making it the complete pain relief package.
The electrode is the top of the device and as such must have good contact with the skin at all times. Beneath that we have the battery compartment, and if we pull in the direction of the arrow, the lid will come off, the battery can be inserted, and the lid goes back into the grooves, push up, like so. The middle light will indicate whether the scanner is turned on or off. This light will increase in intensity as full power is applied. Here are the scenar home device settings. To turn the scanner on, we can press and hold the left-hand key. The device will beep once, indicating it's now turned on. To turn off, again we can press and hold the left-hand key, and we get a multiple beep showing the device is now turned off. To change the power levels of the device, first of all we have to have the device on. The device is now on, and then we can increase the power levels by pressing the plus key once at a time to increase the power level slowly, or hold down to increase quickly. You'll see as we increase the power levels, the left-hand LED light comes on. This is indicating that the power levels now are between 0 and 25% of the total power of the device. If we hold down, increase power quickly, you'll now see that two lights come on. This is indicating that the power levels of the device are now between 25 and 50% of the total power levels of the device. And again, if we hold down, we see three LED lights coming on now, indicating the power levels of the device are between 50 and 75% of the total power. Increasing the power again quickly. We now see that four LED lights are on. This is indicating the power levels of the device now are between 75% and 100% of the total power. And if we push and hold down the plus key, eventually we'll get one beep showing we've reached maximum power. To decrease the power, we can press the minus key once at a time. You see we're still between 75% and 100% of the power. And if we hold the minus key down, you'll see we're down to three lights now, between 50 and 75% of the power levels. Now we're down to between 25 and 50% of the power levels. Now between 0 and 25%. If we hold the minus key down again, eventually we get one beep showing we now reached the lowest power level of 1. There are four options that can be changed on this device, and by pressing the right hand key you can scroll through the options one at a time. When an option is lit, this means that you can set it on or off. And the three options that can be changed to either on or off are D, AM and FM. To set the D option, we can highlight it when the light is on, press the plus key once, and this option is now set. To turn the option off, we can highlight the option and press the minus key. This option is now reset. To change the AM option, we can highlight it, press the plus key, and then to reset, we can turn it off. Note we must have the light on when setting or changing this option. To set the FM option, we can highlight it when the light is on, press the plus key once, and this option is now set. And we can reset it again by highlighting and pressing the minus key. The F, or the frequency of the device, can run between 14, 60, 90 and 340 Hertz. To ensure that we understand what frequency we're on, if we highlight the F key, the F light, and press the minus key 4 or 5 times, we must now be on 14 Hertz. So to change to 60 Hertz, we can highlight the option, press the plus key once, we're now at 60 Hertz. To get to 90 Hertz, we can highlight and press the plus key again, we're now at 90 Hertz. And to get to 340 Hertz, highlight again, plus key, we now must be at 340 Hertz. If you're ever unsure about what frequency you're running at, highlight the option, and while the light's on, press the minus key 4 or 5 times. You now must be on 14 Hertz. So to get, for example, to 90 Hertz, we can then just press the plus key 60 Hertz, 90 Hertz. We know exactly where we are.
You should pay particular attention to the safety aspects, treatment times and contraindications. If there's any doubt as to whether the scenar is suitable for treating a particular problem or illness, it's always advisable to contact your health practitioner first.
Do not use your home scenar device near water. Do not use your home scenar device internally. Please select a low level of power and work your way up to a comfortable level of power before you use your scenar device. Always test your power settings away from the point of injury or pain and work up to a comfortable level before using your home scenar device. Do not use your home scenar device on sensitive areas such as your tongue or eyes.
The scenar device is very easy to use at home, either on yourself or treating family or friends. There are two main ways in which you can use it, either using the device locally over the area of pain, using the brushing technique which is described elsewhere in the DVD, and also every few days you would want to do a balancing technique which we call the 3 pathways.
We're going to go over the area where we got it to see if we can find any smaller symmetries, like so. So we're just literally getting good skin contact, coming over this area and seeing if we can find a smaller symmetry to treat for the pain. So just see how you like holding the device and going over the area, see if you can get the feel for it.
So this is on, is it? Yes.
It's actually off at the moment, but just pretend it's on,
just pretend,
and just go over the area so you feel you get good contact. And we're moving top to bottom, left to right, that's right. So we're not missing any space out. Okay, so you get quite a, how does that feel? It feels
Difficult to know what sort of pressure to apply.
Yeah, I mean typically if I were to show you the sort of pressure, if I show you here, if I'm pushing it on and pushing it such, you can really feel the person you're treating. If you're treating yourself, you'll really feel it sticking. And if I'm doing this sort of thing and hardly getting contact, it'll be a bit jittery. It won't feel wonderful. Just put it on, be firm, but just move it slowly but surely. Not too much pressure.
You don't overdo it, you don't underdo it.
A good way to find out is to actually start treating your own abdomen or yourself and feel what pressure feels good. Okay? Again, when you're doing this sort of thing, you're kind of doing like this. You're coming down. In fact, once you get the hang of it, you can hold it like this.
I see.
And so you're not putting any, again, when you're doing yourself, for example, you'll find that very quickly you understand how you can do it nicely. So for the moment, if we turn the device on, we push the left-hand button, hold it down until you hear the beep. Okay, let go.
Okay.
And what we do is, we're treating this area here, so we'd like to put the device outside where we're treating.
Over here,
and increase the power. And then increase it in sections and then let go, so it can tell us when it's quite comfortable.
Not yet. Yeah, you can feel it now.
You can feel that.
So it'll be quite comfortable.
Maybe just turn it down a little bit.
Turn it down a touch, yes.
Okay.
Okay. Was that probably enough to turn it down?
Just always put it back on. If you're unsure, just put it back on again.
That was too much.
That was too strong. If it was too strong, you put it back on. Always best to leave it on the skin and go up in sections so you find the right level.
How's that?
Yeah, that's okay.
Okay. So it's turned on now. That's all we've done. We've turned it on. We've set the power.
Yes.
We're pretending this is the point of pain. So just be going
start from this side and
That's
go
right.
down. Yes.
That's right. And
Is that too strong?
No, that's fine.
right. And we're just seeing what anything feels sticky at all.
Yes, it sticks at that point.
So which was the point it stuck at?
Around about this,
Okay.
where the pain was.
So,
Yes.
so you'd find if it actually stuck at that point and there
Okay.
was pain there, that would be a good area to treat. So
Good.
just come over the whole area again, looking for the stickiness. Okay. So again, where did you find the stickiest area?
Yes, here.
About there,
Just
okay.
there, yes.
Just there. So having found this area here, we're going to go in 4 directions. Top to bottom, left to right, bottom to top, right to left.
To see where it sticks the most.
To see the stickiest direction. So
Right.
if you want to try that. And then we're going to do this direction first, would be best.
This
That's
direction
right,
first.
yeah.
Okay.
And then we want to go from bottom to top, and then from right to left. That's right. Okay. Now at the moment, because you're angling yourself like this,
Yes.
you'll find it harder to find where the stickiness is. So
hold it, sorry.
So it's just a matter of holding the device right, and of course first when it's new you kind of think, oh, I better hold it like this or like that. But if like this is probably pretty good, because we can turn it easily, and we don't have to lean down. We can actually do it this way.
Okay.
So just see if you can. Okay, and the main thing there again is this is the area we want to look at, so we don't want to do the whole area.
Okay.
Because we're really just interested in this one area, so we're just going over it like such to try and find it. Right. And again, remember, having found the area, we're always going to go from top to bottom to start with. So that's the first direction, second direction, third direction, fourth direction. Okay, so you might have more of an idea now which is stickiest direction.
Yes.
So which do you think is the stickiest direction?
The upward direction.
Going upwards. Okay, so if you want to brush that area in the upwards direction, can you get contact? That's right.
Just keep it very local there, yes?
Yeah, just really right on that sticky area. That's
Faster
right.
or?
You can speed up and maybe slow down a bit. You just really want to see if you can clear it. So if you're finding going faster is clearing it faster, then by all means do that. That's good. Again, remember, if this is really the point, the more precise we can be, the quicker we can clear it, and the more profound the effect. So if that's the point there, and we're just brushing on this, we don't want to be brushing all over the place, because this is the point. Sometimes you might find yourself straying, no, just on that point, and then you get faster results.
So it's almost not lifting from the skin, is it?
You're always going to come off the skin, otherwise,
Very slightly,
it's a good point, otherwise, see what can happen is, if you don't lift from the skin, you end up sort of doing this sort of thing.
Yeah.
Yes?
Does it make any difference if you've got a hairy body to work with than a non-hairy body? Yeah.
Obviously, if there's too much hair and you can't get good contact with the electrode, you've got to shave the hair off. So if you had an area, say for example, right here that had more hair on it, you can't get good contact. You can't get any feedback from the body. So you have to shave or use the hair comb. And the hair comb is actually here. It's got some prongs on here. We can plug this into the device, like so. Okay, and then we could go over the scalp, for example, through the hair. Well, in my case, I haven't got very much to. But say, for example, the point was here, and this was a direction. We could be brushing in this direction through the hair. So these are very handy attachments to have. One of many. And you can hear the sound of the device there. Just for the purposes of this demonstration, I should get Susie to put her arms out at right angles. We're showing you the direction of travel. Classically, we are going to find small asymmetries by making a zone and going from top to bottom and moving left to right. In this situation of having pain on an arm, the direction of travel is like this: down the arm, back down the front, round back down again, and back down this arm in this circular manner. So for example, say we had an area of pain here, and we're going to top to bottom over making a zone of this to find the small asymmetry. We might go in this direction, top to bottom and left to right, going over this area, looking for a small asymmetry which we can then treat. Again, we would do this 3 times over this area. And there's the small asymmetry you have anyhow, and we come over again. Okay, and when we find our small asymmetry, we'll clear it in the classical way. Top to bottom, left to right, bottom to top, right to left, stickiest direction, and clear it. So remember, we're travelling in this direction around the body. as such. So if we had a point of pain here, again, the way we're going to actually find the small asymmetry is we can make a zone of this area, but we're travelling in this direction. Again, if I'm looking at the arm from here, it's going from top to bottom and moving left to right. Looking for a small asymmetry, again going over the area 3 times. Finding the small asymmetry, 4 directions and clearing it in normal fashion. Continuing down the arm here, we come round here, the other arm. So if this was the point of pain here, we can come over this area, travelling in this direction, and from top to bottom moving left to right. And do it 3 times, looking for the small asymmetry. We found it, 4 directions, and clear it in the usual way. Continuing on, we come round here. So again, we're coming in this direction. If we have a point of pain here, again, the direction of flow is here. So if we want to make a zone of this area of the arm and find the small asymmetry, we can come down, usually going from top to bottom, left to right over this area. We come over 3 times, do it 3 times, find the small asymmetry. So when we find the small asymmetry, 4 directions, find the stickiest direction and clear it in the usual way.
One of the techniques you learn is called the 3 pathways, and it is an important one. Even though it may seemingly not relate to the problem you're treating, like a pain in the ankle or a pain in the toes, it does relate to it, because when you treat the ankle and the toe, you ask the whole of the body to pay attention to that. And in the same way as when you are in hospital and you're having drugs, you also have to eat, you also have to drink to keep the whole body into gear to restore. So in the same way, you use the 3 pathways to make sure that everything is in fine balance, and you do that every 3rd or 4th session. So as you are learning about the 3 pathways, you'll hear the term C7. C7 is an important term. It is that vertebrae that you do not treat. You avoid that one while you're working on the 3 pathways for reasons. We won't go into that. C7 stands for cervical 7. The neck has 7 vertebrae, thoracic has 12, and then the lumbar area has 5. And then you get the sacrum and you get the tailbone behind it. So altogether the nature of the spine from the head to the tailbone.
However, it's very important to realise that the one point on the spine that you must not treat is over C7, which is the 7th neck vertebra. I'm now going to treat Suzanne using the 3 pathways. Because she's got some hair covering the neck, I'm going to clip it up first of all to make it easier to treat. The first thing I'm going to do now is locate C7. Now, it's sometimes less easy to find it because it can be less prominent, so I'm going to ask Suzanne to bend her head forwards. You have to feel even more carefully when you can't see it so easily. Suzanne, can you just turn your head from side to side? Now, that's moving quite well. That's also moving. So that's my position of C7. Can you bring your head up? That's fine. And that's shifted just to there. So I'm going to mark out, giving it quite a wide berth, avoiding C7 for treatment.
So we are going to find where C7 is. C7 is the last of the vertebrae. It's in the neck. It starts here 1, 2, 3, 4, 5, 6, 7. So it is somewhere in this region. And after C7 it becomes thoracic 1, the one that belongs to the chest. When somebody is sitting like this, relaxed, shoulders relaxed, you look for the spine of the scapula, the spine of the shoulder blade. The shoulder blade goes all the way here and there's a ridge there. And muscle attached to that ridge. There's the ridge. You draw a line between the aspects of the ridge there, and then you look for the nearest separation between the vertebrae, a little hole in between those bits of bone. There is the one. That is between 3 and 4. An eyebrow pencil, wonderful for drawing on the skin, even when the skin is greasy. That is between 3 and 4, thoracic, indicated like that. So then from there you go up. That's number 3, that's number 2, that's number 1. This is the top of number 1, and then this one is C7. So you go for the spinal scapula between 3 and 4, And you feel easiest with two fingers. With one finger it's not as easy, it's all bumpy anyway. So with two fingers you can dig in just on the side of the vertebrae. And when you go up, there's one, there it is. And that is C7. And it is best to indicate that. Get an eyebrow pencil and indicate with lines where you are not going to touch. Makes it a lot easier, otherwise it's so easy to slide over it. And we want to avoid it. So just to finish this off, if you find it difficult, if somebody has a lot of meat there, a lot of flesh, a lot of muscle, you can dig in on the side of the vertebrae with two fingers and you just go up and you feel those dips, the spaces between the vertebrae till you get there. If you are in doubt, make it a bit larger. Nothing wrong with that. Avoid that area. There's nothing wrong with that. So if in doubt, make the area a little larger.
I'm now going to start with the 3 pathways technique. Susie, I see you've got some goosebumps there. Are you cold?
Yeah, I'm a little bit actually.
So pop this on your front. So before I start, I'm just going to inspect the back to see if there are any blemishes or marks, because it's important that we see, we get a baseline so that we've got something to compare it with. And checking through, I can't see any at all. So I'm going to first of all mark where C7 is. Susie, can you just bend your head and just turn from side to side? And again, keep turning. Again. Alright, so our C7 is there. Just bring the head up. So I'm going to make a mark there, which is the area we're going to avoid treating. I'm now going to mark out the paravertebral regions, and we use a gap of 1 electrode from the centre. So, and each paravertebral area is 3 down. 1, 2, 3. And we're following the line of the spine. 1, 2, 3. And we've got just 3 left there. It's important that we do each side separately, because sometimes if there's a curve in the spine, you are going to get a difference with the paravertebrals. So you've got 1 space there. One, 2, 3. 1, 2, 3. 1, 2, 3. As you can see, the spine does curve slightly round the side, so it's slightly off centre there. So now I'm going to set the power to a comfortable level, roughly 4 to 5 out of 10, and I'm going to put the device on the skin away from the area to be treated, turn it up until there's a comfortable sensation. Susie, can you tell me when it's about a 4 to 5 out of 10?
Okay.
That's about a 4 to 5? That's all right?
Yeah.
I'm going to test it on the other side.
It's okay.
That's fine. I'm going to test it further down.
Okay.
And here.
Okay.
Down here.
Okay.
And here.
Yeah, that's fine.
It's important that we check all 6 areas, because we don't want to find that we start up here with a comfortable level and then by the time we get down to the bottom the power is too strong. So I'm now going to start just below C7 in the centre of the spine, and I'm going to move very slowly down the spine with quite a firm pressure, and as we get to an area that's sticky here it tends to drag more, but I'm going to move it down the spine. That's quite sticky there as well. Move it all the way down right to the base of the spine, and then on the neck just to above C7. We're going to repeat that 3 times, moving down slowly, and we note any areas that are sticky. Again, it's sticking here. Move down right to the base of the spine, and up on the neck, and a 3rd time moving down the spine, again sticky there, moving down right to the base, and then on the neck just to above C7. I'm now going to work on the paravertebrals, starting below C7 where I've marked out, and I'm going to do the first area 3 times. This seems to be fairly smooth, and here again there doesn't seem to be any stickiness. To work on the second section, this is quite sticky here, so I'm moving slowly down. Second time, and you can see when the stickiness ends, it tends to jump a little bit as it moves more quickly. Again, I'm going to move onto the other side. Slightly sticky here as well. And again, a little bit less sticky the 3rd time we went down. I'm going to go on the 3rd section now. This again is a little bit sticky towards the bottom here, and on the other side this again is quite sticky at the top here. You can see it's quite jerky as it's dragging. I think this is probably the most sticky area that I've had in the spine so far, and we're just going to do the bottom part. And on the other side. That was quite smooth, and we're just going to finish up on the neck. Again, keeping 1 electrode width away, 1 space away. I'm just going to do 3 times on the neck. Having finished the 3 paths, I'm now going to look at the spine, and as you can see we've got 3 areas that are red here, so these are our 3 asymmetries, and there was 1 area down here that was the most sticky area, so I'm now going to work on the stickiest area, and I'm going to work in 4 directions to see which is the stickiest direction. And so I'm going to work top to bottom, left to right, bottom to top, and right to left. And in fact the stickiest direction was top to bottom, so I'm going to work on that until it clears it, and that's cleared quite quickly, that's running smoothly now. I'm going to work on these red asymmetries now. So although these 3 areas are red, they were also very sticky. So I'm going to go over them in 4 directions and clear them in the usual way. I'm going to start in the middle, and again I'm going to work in 4 directions, top to bottom, left to right, bottom to top, and right to left. And the stickiest direction there was left to right, so I'm going to work like that. Sometimes the skin is pulled, so just pop a thumb there to keep it taut, and that's cleared it now. And I'm now going to work on the left hand one, again top to bottom, left to right, bottom to top, and right to left. And the stickiest one was top to bottom. This is quite sticky, and now it's clearing. Sometimes you won't be able to clear it fully, but as long as you've made a change and it starts to clear, then that's sufficient. I'm going to work on this right side now, and again we're working top to bottom, left to right, bottom to top, and right to left. I'm not sure which was the stickiest direction, so I'm going to do it again, top to bottom, left to right, bottom to top, and right to left. And it was the bottom to top, so I'm going to work on that, and that's cleared. So that's the 3 pathways completed. Now I'm going to treat the 6 points on the face, and it's very important to remember to turn the power down before you start. I'm going to set the power level away from the area that's going to be treated, and I want you to tell me when it's a nice, comfortable, tingling sensation.
Okay.
So I'm going to start with the first point, just at the corner of the mouth. Hold it on for a couple of seconds. I'm going to go to the second point now. Hold that on for 2 seconds. And the third point here. 2 seconds. Fourth point. That's done. And now the 5th point, we're going to lift the eyebrow up and hold the device just under the eyebrow so that it's well away from the eyelid. Hold that on for 2 seconds. And the last point on the face, again, hold the eyebrow up, pop that on for 2 seconds. So having completed the 6 points on the face, I'm now going to look for any area of small asymmetry. I'm looking for any area of redness or change in skin colour, and I can't see any. So Susie, which point did you feel the most sensitive when I put the device on?
This point here.
Right, so I'm now going to treat this point for 30 seconds. And that's the 3 paths and 6 points completed.
Okay then, John, so you've got a problem with your left foot.
Yes, it's an old motorcycle injury, I think.
Okay, and whereabouts have you got the pain at the moment?
It seems to be here, just on the instep and coming underneath the ball of the foot.
Okay. Again, is there one area you could point to with one finger?
I would say around there, yes.
So really sort of about this area
Yes.
here you could point to, okay. And what about the right foot? Have you got any pain on the right foot at the moment?
No.
So really just this pain. And if we would take a scale of 1 to 10, 10 being really strong and 1 being nothing, where would you put the pain level at?
It's very painful when I walk on it. I'd say about 7.
About a 7 out of 10 the
I'd
pain
say
level.
7
Okay.
out of 10. It's
Okay,
very
fine.
painful.
Okay. So if you just put your foot down again, that's fantastic. Rest it here. Okay. Again, what we're going to do is we're going to turn the device on, hold it down, get a beep, put it outside the area we're going to treat, and then we'll increase the power level. Just tell me, John, when you can feel it. So it's quite comfortable?
Yeah.
Okay, so that's okay though, isn't it? Now remember, with feet, they can often be quite sensitive. So if we're taking a level outside here, we've got to be aware that it could be quite strong here, so I'm actually going to decrease that even though he said that's comfortable, just in case. Back to 60, okay. So really this is the area here, about here,
Yeah.
so tell me if it's too strong when I apply it.
Okay.
Again, with feet and everything else, remember that you need to have the electrode flat and flush to the skin. It's very easy to not be aware because it's slightly angled, and sometimes it's something you know it might not. Let's go over here then, it's like so. And guess what? It's stuck right on this area. Is that strong?
Yeah.
So again,
That's right.
right here. Is it stronger sensation there at all? It's about the same?
Yes, yeah, it's
Yeah.
the same.
Really, it's right here. So we're going to go. And really it's this direction here. It's very, very sticky. I can feel it straight away. So I'm actually just going to start brushing. And again, I'm not going to brush over the entire area. It's just this point. Quite an intuitive device and intuitive actually doing it. Sometimes you'll find that you can seem to get better results going slightly slower, sometimes slightly faster. I tend to vary it. So I might start off fast and then go slow, but already I can see that there's a change in this. Huge change, but totally different already. Okay? You can hear the noise of it now. Do you hear the difference in the noise? So I'm going over it again.
Yeah.
Completely different in 20-30 seconds. You just tell me, John, is the pain in the same place when you walk on it?
I can't feel the pain in my foot now.
Good.
It seems really calming, this, but it's gone right down to 1 or 2.
Right. Again, this happens so frequently that sometimes you feel like laughing because it just seems like magic, and that's why, of course, the press have dubbed this type of technology electronic Reiki, electronic acupuncture, Star Trek medicine. It really can work that quick, and it'll surprise you because you'll do something that you really. I've had people who've hit themselves with hammers and similar things, and you're just there to treat them, and literally within a matter of 2 or 3 minutes, they'd hardly know they've ever hit themselves with a hammer, or the pain has almost completely gone, in many cases gone completely, and no bruising either, which is interesting. So thank you, John.
That's great.
Great. We're assuming here you've got a problem with some sort of pain or something in the abdomen here.
Yeah.
And again, we're going to, you want to do a self-treatment over this area. So you might want to put the device over here outside the area of treatment to increase the power. So we get the power right.
Yeah,
how's that feel?
Right, that feels right.
Good.
Yeah,
And
good tingle.
okay, so now we're going from top to bottom. We're going to be trying top to bottom over this area, looking for stickiness, etc. Okay, and you've obviously got something going on there anyhow, because it's quite sticky. So again, continue just over, so just that's right. So I might come over this area again just to make sure that this really is the stickiest area. Okay, it's really sticky, and just continue. So it's all a bit sticky, but this is probably the stickiest. Again, we're going to do 4 directions over that to see which is the stickiest direction. That's it. Okay, one thing you can do here is, because you're putting the skin up, you might just want to hold the skin down with one hand so you try and get a clearer idea of how sticky it is.
Okay.
That's it.
So going
So come down.
that way, that way.
Yeah. Very sticky, isn't it?
Stickiest way, that's
And then right to left.
stickiest
So again,
way.
you're going to be brushing from bottom to top. That's it. Fantastic. Great.
It's different. Yeah.
Change already.
Yeah.
So it's incredible, isn't it? That was about 4 or 5 seconds.
Yeah. Yeah, it's gone smooth.
Oh, it's smooth now. Okay. So if that had been an area of pain, for example.
Yeah, that's smooth.
Yeah, brilliant.
Okay.
Fantastic.
Thank you.
Just one thing on here. If, say, we've been treating this area here and the pain hadn't changed as much as you would like it, you could again treat the symmetrical zone or area here. So if you just like to go over the symmetrical area, but in effect, probably which the directions we'd remember you're treating yourself would begin like this. Very sticky, isn't it? Up.
Yeah.
Okay, so we'd imagine you treat someone else is treating you. You're treating yourself. So you're going top. And it was sticky, it was going this way, wasn't it?
This way, yeah.
So again, you'd be clearing it that direction. That's it.
Clears it.
Fantastic. Brilliant.
Thank you.
Okay, so you've got a problem with the wrist here. Is it the right wrist?
It's in fact both wrists, but I fell from a height and
Right.
I landed on my feet, but used my hands to stop the
Brake.
fall. And they've been causing me problems. I went to the hospital and there was no break there, but
Right.
it feels there's pain there from time to time.
Okay. Have you got pain there now?
Just a little. I notice it more when I'm picking things up.
If you clench your fist, can you feel the pain? Can you generate the pain now?
Yes, a little.
You
Yeah.
can. So if you really do it to generate the most pain you can,
Right.
this area. If you held something, if you held it?
Yes, I can feel it more now. Yes.
Right. If you just point to exactly where you feel the pain. Okay, across there. So we've turned the device on. We're going to put it outside the area of treatment. We're going to increase the power. If you just
Yeah,
tell me
that's
when
okay.
it feels okay. Fine. And so we're going to just come here. So we're going to be running over the skin here. Very, very sticky indeed. It's hardly moving. I'm dragging on the skin. Oh, completely stuck. Completely stuck. Can you feel that? In this area?
Ooh, I feel
Very strong, yeah?
tingling down there
Right.
when you did that.
Was it stronger here then?
Yes,
Stickiness?
just there, yes.
So again, sensation, very strong feeling. I'm going to turn the power down a tiny bit further. Right, go over this area. Right, so just going to go one more pass. Very sticky, the whole area. Very sticky again. Is that sensation quite strong?
Yes.
Over here, very sticky as well. It's dragging in. See? Oh, this direction's completely stuck. Completely stuck, okay? So we found the direction we want to brush in, so we're going to start brushing. You feel anything there at all?
No, not
Okay. Now notice there's no sound on the device at the moment. You can't hear anything as well.
So, Richard, can you tell me why there's no sound coming from the device at the moment?
Well, again, that's probably another small asymmetry, although we found as we went over the whole area here, there was no sound anywhere.
Right.
So we're just aware of the fact that if there's no sound, that's interesting because as we're treating, sound comes back, it's something else to be looking at.
Okay.
It's going to increase the power level a tiny bit. I can detect that there has been a slight change in the stickiness. It's not huge, but there is a change there. I'm just going to actually go over this area again and just see. You see it's moving, the whole area now is actually moving quite sticky there. But in fact, the whole area is actually a bit clearer. There's not so much stickiness in the entire area. But still, it's this area here is still rather sticky.
Yes.
So again, I'm going to just go in 4 directions again.
Why would you change the power level?
Again, it's sometimes a subjective thing that you do. You feel it better to put a bit more power.
And what do people feel during treatment? It's like pins and needles.
With me, you feel the rubbing sensation, obviously, of the device, but there's a tingle going right the way down my fingers at the moment.
Right. So it's still quite sticky, but we have made some change. Just tell me, if you clench, does it feel exactly the same? Is the
No, it feels there's more movement there.
So if you feel like it's been
the pain level is almost gone.
Right. So the actual pain's not in the same place, or is it in the same place?
No, I don't feel hardly any pain across there at all.
Okay.
Yeah.
And so it feels a bit easier to use.
Yes.
Okay. Fantastic. Okay. John, would you like to get up, please, if you can, and let's have a look. Right. So obviously, I can see you have quite a bit of pain at the moment.
Yes.
Would you mind taking your shirt off so we can actually see the actual area of pain on your back?
No, I don't mind. No.
Great. So John, tell me at the moment, you've got fairly bad back pain, I can see. Whereabouts is the main pain? Can you point to it with one finger?
Well, you'll be able to see that I had an operation somewhere around here.
Yeah.
And the pain generally tends to be around here to the right, around the right sacral joint.
So on the right hand side, out of 10, if 10 was unbearable pain and 1 was hardly any at all, what would you subjectively just say within a second the pain level was on the right hand side?
2 is about 7.
About 7. And on the left hand side?
Probably on about 5.
About 5. And do you have any other pain anywhere else in your body?
I have pain in my neck.
Your neck. Okay. And again, we can point with one finger, can we, to...
Yeah.
Okay.
Around here.
And what would you say the pain level was in your neck at the moment?
I'd say about 6.
6. So really we've got 7 down here, 6 up, and about maybe 5 over here. So really we're going to start now where the pain is actually stronger. Okay. And just tell me, John, when you can feel the impulse from the device.
Yeah.
Can you at all? I want it to be fairly comfortable, but the strong end of comfortable.
That's about right now.
That's about right, okay. John's indicated the pain is in this particular area. As we're running the device over this area, we get very sticky here. The device is sticking, and as we go further down, it's really sticking. As you can see, it's dragging itself across the skin, and it's absolutely stuck solid. This is exactly the area that he's experiencing the pain in. I'm just going to go over the whole of this area. You see that sticking there? It's a juddering as I'm moving it across the body. And it's a juddering again. So all the sticking and the juddering is in this sort of section or segment here. And the worst area is about here. So I'm going to go in 4 directions now.
Just turn it down.
A bit too strong, okay.
It's got a bit strong.
Okay. 4 directions. And the stickiest direction is actually up. It's dragging more, it's sticking. I can hardly move it. So I'm just going to start brushing now in this direction. How's that feeling, John?
That's fine, that.
Okay, not too bad. I've just changed the frequency to see if I'm getting a faster response on clearing the stickiness in this direction. So you can see as I'm going up still. So I'm getting good contact with the scanner. So again, remember we've got an angled electrode here, so if we were like that, we're not getting good contact with the skin, it's important. John, do you just tell me, does the pain feel in the same place at the moment?
Yes, but it does seem to have gone down a lot.
You say it feels different at the
Yes,
scale of...
yes.
So out of 10 now, where would you put it?
Well, it certainly seems 2 or 3 now instead of 7.
So 2 or 3 from a 7?
Definitely, yeah.
Already, okay. Where would you say the worst pain is at the moment, taking account of this side has almost gone down to a 2 or 3?
Probably here in the middle.
So it's in the middle here, is it? Okay, right. Again, we've got a nice sticky area right where John's pointing to. This time, the stickiest area is going down. It's from top to bottom, so we're just going to giving that a bit of a treatment. Again, some people tend to stroke. Okay, John, just tell me again now, is the pain in the same place or has it moved?
The pain seems to, it feels as if it's gone. The pain feels as if it's gone. That's the sensation that I'm getting.
So when you say gone, you can't find where the pain's gone to?
No.
And so, out of 10 now?
I would say 1 or 2.
1 or 2.
Yeah.
So again, we've done what? A minute?
It's amazing, that.
60 seconds? We've gone from a pain level of 7, 5, to virtually, can you find where the pain's gone? We always ask, can you find the pain? Not, what level is it now? Because if someone has in their mind that it was a 7, they might just come back and say, oh, it's still a 6. Even though the pain's gone, there's a memory of that pain. So always ask, has it moved? And if they can't find it, you know you've got a result. At the moment, you also said that your shoulder was a 5 or 6 out of 10.
Yes.
How does that feel at the moment? Is it the same or has it moved?
It still seems round about 5.
Okay, so I'm going to put it back on the skin now and change the power level again. Just tell me it's quite comfortable. Is that quite comfortable now? And already you can see that we haven't increased the power that much. He's already saying, oh, that's quite strong now. Now, although we did it down here earlier on, his body seems to be more aware of this device now. Point with one finger, if you can, John, to where the pain really is. Okay, and it's about a 5 or 6 out of 10, is it?
Yes.
Okay.
So are you looking for sticky bits here?
Yeah, I'm looking for stickiness. He's saying the pain is here, but I'm looking to start with, see if I can find any small asymmetries, which are typically stickiness in this question.
Does asymmetry mean stickiness?
A small asymmetry is an area which is different from other surrounding areas of skin. And at the moment,
It feels like it's sticky.
it's very sticky here. So although you're saying the pain's here, I'm just going to actually look at this area here. In 4 directions. 1, 2. Is there a direction that's more painful there, John?
Yes, that way.
This one, okay. So again, he's very sticky all over. I've actually increased the frequency again because I think I'll get a better, faster result. I'm going to change it back. Just tell me at the moment, does the pain in the shoulder, is it in the same place? Does it feel the same?
No, it's gone right down. Well, it feels miles better.
I went over the entire shoulder area looking for a small asymmetry stickiness, and we actually found that the stickiness wasn't actually where the pain was, but as we found it, we went 4 directions over it, top to bottom, left to right, bottom to top, right to left, found the stickiest direction and we cleared it. And already he's saying the pain has remarkably changed. So it's difficult to find exactly where the pain was now?
Yes, I couldn't find it now.
Okay. So, and how long did that take? 30 seconds? So again, for pain relief, absolutely fantastic. Thank you, John.
Thank you.
Fantastic. Colin has a problem with the shoulder. The point of the pain or the problem is about here. And so we're now going to show you how to try and clear that. So of course we're going to turn the device on. We're going to put the device outside the area. We're doing the collar zone here, the 2 areas of the shoulder. Put it over. I'm just going to increase the power until you can feel it. So just tell me when you feel it, Colleen.
Yes, I
Right.
can.
Come to a level of power. And we're going to start brushing down this area of the shoulder, looking for small asymmetries. So here we go. Coming down. And actually it's quite sticky here. Okay. Sticky area here, we're going to come down again. Often we can do this 3 times if you like. And very sticky here now. This is our smaller symmetry. So 4 directions. Gauging how sticky it is in each direction. Now again, it's pretty similar. I'm not too sure. I'm going to go over it again. Aha, right. So this is the stickiest direction. So we're going to clear that now. And at the moment we've got the device set to a default of 60 Hertz. And it's clearing quite nicely. And it seems to be pretty much clear already. And it is. It's clear. We can go to the symmetrical shoulder now and treat this. So what we do, we come to this shoulder here. Let's do that. We're going to come down here. In fact, we're very sticky at this point here. Just going to come over here again. In fact, it's sticky there. 2 areas of stickiness, but this is the stickiest. So again, we're going to go top to bottom, left to right, bottom to top, and the stickiest area is this direction. So I'm going to clear that now. If, for example, we had a very strong, painful area, what I might do now, as I'm clearing this and it didn't clear, I might just change the frequency of the device up another frequency. You can probably hear as I'm doing this now that the noise the device makes is slightly different. It's a bit of a higher tone now. Again, completely clear now. Okay, this is a technique to treat a point of pain. This is a point of pain you can put 1 finger on. What one will do is to take the device, turn it on. We're going to put it on outside the area of the point of pain we're going to treat. Increase the power level until you can feel it quite comfortably. And then we're going to set the FM option on, place it on the point of pain for between 3 and 7 minutes. During this time, we should have a reduction in the pain, or the pain should have reduced completely. On Susie here, an imaginary area of pain, and we're going to make a mark just here, and we're going to say this is the point of pain that we need to treat. So, Susie, if you'd like to take your device and turn the power on, and if you want to put it outside the area you're going to treat but near to it, and increase the power level until you've got a comfortable comfortable sensation, maybe a 5 out of 10 if 10 was very strong and 0 was very weak. When you're happy with the power level, you take the device. If you want to set the FM option, okay, and now place it over the point of pain and leave it between 3 and 7 minutes. And within this time, we'd expect a reduction in pain or the pain to have disappeared completely. Okay. What may happen is that between 3 and 7 minutes, the pain may reduce considerably, but you might have a new point of pain. So a point of pain may appear, for example, on your arm or the leg. Again, something you can point one finger to. In that case, you do it following the same technique. You take the device, put it near where the point of pain is, but not on it. Increase the power level till it feels a good comfortable level, set FM, and again place on this area of pain for between 3 and 7 minutes, where again you should get a reduction in that pain or it should disappear altogether. This is a particularly good technique when you have a pain that you can point to with one finger.
I suffered for 13 years with RSI, or the other name for it is carpal tunnel syndrome, which meant I had terrible pain in my wrist and arms as a result of working on a computer for 13 years. And when I got the home scenar device and gave myself treatment, then after several treatments, the pain actually went, and nothing has been so dramatic and pain relief ever. And I'm just really happy now. I'm completely pain-free.
I was due to go skiing in America for 2 weeks, and roughly 10 days before my trip I had a nasty fall playing netball, where I played netball at quite a high level. Unfortunately, I landed on my ankle and badly sprained my ankle. I was in an awful lot of pain, and my ankle swelled up pretty quickly. I was just about able to drive home, and whilst I was driving home I rang up Richard and said, "Richard, can you help me out? I know I've badly damaged my ankle. I'm going skiing in 10 days, and I know with scenar, the quicker the treatment is delivered to the affected area, the better." Fortunately, Richard was in, so I was probably at his place within an hour of the incident. He treated my ankle, which is basically he rubbed the device over my ankle. I always find it amazing because the scenar machine is totally smooth, but when you're being treated it feels like it's stuck in tar. It's very, very effective. You can really feel it working whilst you're having the treatment. And he basically kept rubbing the machine over my ankle and sending the pulses, if you like, through my ankle, which I could feel at the time. By the time we'd finished the treatment, which was about half an hour's worth of treatment, I suppose, the swelling in my ankle had reduced dramatically. It wasn't far off my original ankle, and the pain had dissipated enormously, to the point that I wasn't crying anymore, I wasn't squawking my head off, and I could actually leave the couch without too much discomfort. I carried on having treatment with Richard about every other day for about 4 or 5 treatments before I went away. And by the time I went away, I could put my ski boot on, which is quite a tight, awkward experience to try and put a ski boot on, and could ski the whole fortnight without my ankle bothering me whatsoever.
Yeah, there was some discomfort, extreme discomfort in the upper gum area here, and the scenar was applied there, and over a period of about 2 treatments, the discomfort actually went completely. It in fact turned out not to be an abscess. It turned out actually to be a form of gum decay. But the discomfort was certainly removed by scenar, certainly after a couple of treatments. Some weeks ago I had quite a bad bicycle accident, coming off a bicycle very fast on a corner, and I hit the right hip badly. I went to see the scenar therapist because I wasn't quite sure where the damage had occurred, and it was all around the hip joint itself, both on the outside and on the inside. After the scenar was applied the first time, there was a localizing of the pain back to where it originally came from, which is on the outside of the hip. And then on a second treatment, that also was considerably reduced. And the result was that I felt much more relaxed, and by being more relaxed, it seemed to allow the hip to move more easily and somehow refacilitate the joint movement and improve the general condition.
I was suffering from heel spur, which is the inflammation of the tendon along the base of my foot, in acute pain, and I went along to the health and beauty evening with my daughter and met Helen, who is a scenar therapist, and got into conversation with her. She said that she was certain she could do something, and I was desperate because I was in such terrible pain, and I'm a very active person, and it was affecting my quality of life basically, so I was desperate. The doctor gave me anti-inflammatories which just did nothing, so I thought, what the hell? I went along and had 5 treatments from Helen, and significantly different from the first treatment.
In what way was it different?
It changed the whole sort of feeling in my foot. It was hard to say really, because I was getting sort of transferred pain up the back of my leg to my knee, and as soon as I stepped off the couch I could feel a difference.
I had a skiing accident some years ago, and tied in with playing a lot of tennis, I developed quite a serious pain in my spine, and especially while I was playing tennis, it carried on for a number of years. I went to see a chiropractor, an osteopath, without any joy, and within a matter of 3 treatments, within 2 or 3 days, the pain completely went, and this was some years ago now, and I have been playing tennis ever since, and no reoccurrence of the pain. Really happy.
Well, I had this wasp sting a little while back, and I remember it was so painful, and my foot swelled up, and I just wanted the pain to go away because it was just unbearable. And my dad, luckily, he had a scenar device, and he put the device on my foot for about 2.5 minutes or so, and when he took it off, all that was left was a pinprick, and the pain had completely gone.
Knowing that I have it in my bag or my pocket has given me a great deal of ease, and literally taken away some very nasty pains. There was one time when I suddenly had a very sharp pain, and I can't imagine what it was or where it came from, but by doing the simple brushing with the scenar device, which you are shown how to do, or you see from your instructions how to do, it cleared it up in no time at all. I was then able to go to the doctor and get it thoroughly checked and find out what was going on. But meanwhile I had been free of this very nasty, sharp pain.
My experience with scenar goes back to 2004, so about 3 years ago, when I had the onset of frozen shoulder syndrome in both of my shoulders, which is fairly unusual. It's a very painful condition to have, and one which is very difficult to treat. I tried several alternative therapies, including chiropractic, and you know, I had a slight amount of relief from that, but marginal. With scenar, with Richard treating me with scenar, the relief was, you know, I could feel it within the first 1 or 2 treatments. Through that course of treatments, I got back about 80% of the movement in my shoulders, which, you know, if you would ask most doctors, they'd say was nigh on impossible.
There are certain instances when the scenar should not be used for self-treatment. The following contraindications apply to the person receiving treatment. If you are pregnant or menstruating, if you are unsure as to your cause of pain, if you are overly sensitive to electrical stimuli, if you require pain relief over the site of a tumour, if you suffer from cardiac fibrillation or arrhythmia, if you are under the influence of alcohol or illegal substances, if you have any implanted electrical device, such as a pacemaker, or if you are in an acute psychotic state or have severe mental disorders. Please contact us for more information about how you may be helped if any of these contraindications apply. Always contact your medical practitioner if in any doubt as to the nature of your health concerns. Each individual area of pain, less than 5 minutes or up to 7 minutes if using the FM single point technique. 3 pathways and 6 points, less than 15 minutes. Maximum total treatment time in any one session, 20 minutes. Maximum total treatment time in any 24-hour period, 30 minutes. Areas of acute pain can be treated every 2 hours. The scenar device does not heal injuries on its own. It re-educates the body, allowing accelerated natural healing as the body uses its own internal pharmacy of bioactive compounds. There are limits to how much the body can heal itself at any given time. If the device is used for a longer period than is recommended, it is possible that its resources become overstretched, which can lead to a healing crisis. Physical symptoms may include skin eruptions, nausea, headaches, sleepiness, unusual fatigue, constipation, diarrhea, head or chest colds, ear infections, boils, sneezing, bringing up mucus, or coughing. A healing crisis is unlikely to happen if you follow the techniques shown in this DVD. If the point of pain is not accessible because it is bandaged, in a plaster cast or has a plaster over it, treat the symmetrical point of pain. For example, for a painful left elbow, treat the same point of pain on the right elbow. This is also a good technique to use if the normal methods have not reduced the level of pain significantly. If brushing the small asymmetry does not result in a dynamic change, try increasing the frequency of the device using the F option, and then continue brushing. Do not worry if you only find sticky areas rather than other types of small asymmetry. They are by far the most common. If you find more than one small asymmetry in a zone or area, treat the most prominent first. If there are a number of small asymmetries that need treatment, you can make a small mark on each one with a non-toxic pen so that you don't forget their location. If you find more than one sticky area, make a slightly larger mark on the stickiest one and clear that one first. You only need to make a small change in order to allow a healing response, pain reduction, by the body. For example, a very sticky small asymmetry does not have to be brushed until it goes away completely. Just making it less sticky, or more sticky for that matter, will still be effective. Applying too much pressure when moving the electrode over the skin can make it more difficult to find the small asymmetry. Always consult your health practitioner if you are in any doubt as to the cause of pain.
We hope you've enjoyed this introduction to scenar DVD and have found it useful in helping to start using your scenar home device. But so much more can be achieved by attending one of our training courses. Please visit our website where there's a complete section on training and education. We run courses in the UK, Europe and the USA at all levels, from introductory levels up to specialist techniques and cosmetology.